Welcome, everyone. I am your moderator, Alicia Poulos. I'm an assistant professor in the College of Health Solutions at Arizona State University, where my research focuses on integrating movement and physical activity into daily living. Most of my research is in school settings, and I work to overcome challenges to integrated movement to support children's health, and one of those challenges certainly is heat. I'd like to thank you for joining our Health Talks webinar, brought to you by the College of Health Solutions at ASU. Our college works to address the challenges facing people and communities to stay healthy, improve their health, and manage chronic disease. These health talks are one way we serve the community with timely and relevant educational information that also provides continuing education credit at no cost. I am so excited to introduce our two speakers. First is Dr. Alicia Montalvo. Alicia is a certified athletic trainer, injury epidemiologist, avid collaborator, and clinical associate professor of movement sciences at ASU's College of Health Solutions. Her research revolves around injury epidemiology in physically active populations, identifying intervention points based on the socioecological model and health equity. Her recent work has focused on the health impacts of climate change, including heat-related injury epidemiology and injury prediction in youth athletes and children. Her goal is to develop more effective heat injury prevention strategies and policies in these populations. Today, Alicia will be followed by Dr. Patricia Solis. Patricia is Executive Director of the Knowledge and Exchange for Resilience at Arizona State University and Associate Research Professor of Geography. She works with local communities, city, county, state officers, and national agencies like the Arizona Office of the Governor, FEMA, and the U.S. Census Bureau on data and solutions related to heat resilience. A global scholar, she uses open geospatial technologies in humanitarian mapping contexts to inspire youth action to address climate perils. We are so fortunate to have both of these health experts with us today as we explore Hot and Bothered, a conversation about heat and health. So how do we handle a hotter world? How do we protect those at highest risk for harm? Today, we will explore the critical challenges and solutions for protecting at-risk groups during extreme heat events. Before we begin, a couple of quick housekeeping items. First, this session is being recorded and it will be posted on our website, asuhealthtalks.com. After the panelist presentations, I will moderate a Q&A session. We'll have about 15 to 20 minutes for Q&A. Please submit your question using the Q&A feature, not the chat box. Also, make sure you get credit for attending today by using the self-check-in link posted in the chat. And finally, you will receive a brief survey asking for your input about today's webinar. If you are requesting continuing education credits, this must be completed in order to receive credit. If you did not apply for CEUs, we would still appreciate your feedback in order to improve our series. Okay, and without further ado, I am delighted to hand it over to our first presenter, Alicia Montalvo, with a presentation titled TIL, a Reddit-inspired heat and health talk.
Hello, and let me just get started here. It's set up. Thank you, Allie, for that most excellent introduction. You're ready to become a professional. All right, my name is Alicia Montalvo. I'm a clinical associate professor of movement sciences in College of Health Solutions. I'm also an athletic trainer and an injury epidemiologist. And while my research focuses on physically active individuals, I need to know about all individuals in order to be able to do that research. So I have used Reddit today to inspire my talk. It's a TIL, today I learned. So I'm going to be using things that I've seen on Reddit to kind of guide our journey today, and it's all going to happen super fast. So let's get started. All right, I'll give you a little bit of a background on heat so that we can understand the context. Then I'll talk about heat and its effects on health. I have to talk about health disparities because it's like a very important thing to talk about when we're talking about heat. And then we're going to finish with my area of expertise, which is heat and child health and safety. And that's where I focus most of my work with youth athletes. So my heat primer, let's get started. Global average surface temperature is expected to increase between 1.1 to 5.1 degrees Celsius by the year 2100. I've got some maps here that'll show you the distribution of where these changes are expected to occur and in what magnitude. So it's going to be more in the northernmost and southernmost latitudes with the highest temperature changes. But even modest temperature increases in places like Phoenix, for example, are going to have severe consequences because it's already super hot here, as we know, especially during the summer. I pulled some information from the National Weather Service on the warmest temperatures in June, July, and August. You can see most of these have occurred pretty much within the last 10 years. Obviously, 2024 has not made it yet, but we'll see July and August, whether or not we make it there. As we can see from Reddit, we have already made it in the month of June with a average high of 109.4. And actually, the monthly high temperature was 97 degrees, which is about almost 2 degrees hotter than the next highest year. So like substantially hotter. Why is this happening? We've got the urban heat island effect. We're really famous for that here. What is the urban heat island effect? It's basically, we're here in an urban area and the radiation from the sun, the heat gets absorbed by the structures. So the cement, the streets, the buildings, and the structures kind of hang on to the heat and let it emit kind of slowly overnight, which is why the temperatures at night are probably higher than they need to be. This is in contrast to more urban, suburban, rural areas with parks where there's green spaces, shade, maybe the grass is being watered. And so there's kind of like, it's able to get a little bit cooler at night. And then during the day, it doesn't get as hot. Whereas in the city, we get really, really hot during the day. Then we hang on to and emit that heat overnight. And the nights are also very hot, especially during heat waves. So that's partially why the city's heat mitigation strategy of planting trees is so important. This is one I saw on Reddit last week. This refers to the NASA Jet Propulsion Laboratory images about thermal heat risk on the sidewalks and streets in Arizona and Phoenix. You can see the yellow is 100 to 130, 120 to 130 degrees on the streets. Red is 130 to 140 degrees on the streets. And then purple is 140 to 160 degrees on the streets. You could imagine that this is going to have pretty serious health implications, not just for people who are walking or, for example, riding their motorcycles on the streets, their bicycles on the streets, but let's not even mention people who maybe fall unconscious on a sidewalk for long periods of time in very hot areas. So let's let that guide us into the health impacts of heat. This is on the left, you see how it started. This is a post I saw a couple of months ago, maybe in May, about how the highs were last year. And unfortunately, a lot of people passed away due to the heat. And so hopefully we didn't have a repeat. And then you can see on the right here that I think I got this last week, that heat-related deaths have already doubled this year in Phoenix. So what are the factors that influence heat-related morbidity and mortality? We've got these hot nights, right? So this unrelenting heat, the structures maybe in the urban heat islands, they absorb that heat, make it even hotter overnight. So this increases risk of cause-specific mortality. We've got heat wave intensity. So the days of extreme heat are associated with increased risk of all-cause hospitalization, especially in elderly individuals. We've got the urban heat island effect. So again, retaining the heat, relentless heat overnight, causing hotter days. And so we're going to see more cases in urban areas, and we're going to see in places that are more rural or have access to more green spaces. And then we've got individual risk factors. I'm going to talk about epidemiology here in Maricopa County. I want to give a shout out to Maricopa County Department of Public Health, the heat people there. They're doing an amazing job with the dashboard and also with their annual mortality reports. All of this stuff is taken from the 2023 report. So I'm just going to review some basic things here. You can see that there's an increased risk with certain health conditions, especially cardiorespiratory disease. And this is likely just because most people, if they're, as we age, this is like just a very common thing for people to have cardiorespiratory disease. But also obesity and diabetes seem to have a good proportion representing as well. Males, mortality was higher in males, 78% versus 22% in females. Mortality was highest in those between 50 to 64 years of age, 29%, followed by 35 to 49, 25%. 45% of individuals last year were unhoused, and I can't really see the percentage here, 65% involved substances. Something else I wanted to note was that 60% of the individuals impacted were white, non-Hispanic white, though there was a disproportionate impact by Black and Native American. This means that there were a greater proportion affected by mortality than represented in the population. And I know Dr. Solis is going to be talking about this, so I wanted to touch on it as well, that 33% of deaths occurred indoors and 8% of those were in mobile homes. And I think the most shocking statistic here is that of those deaths, about 95%, a vast majority of them, had to do with air conditioning being present and not on, air conditioning being present and broken, there not being electricity, or there not being an air conditioning. So you can see that there's, between the mobile homes and the lack of air conditioning, is probably an association with poverty here. So 50%, more than 50% of days were of the highest heat risks classified by the National Weather Service. And I think it's important to note that it's not really, these warnings aren't really associated with reduced risk of mortality, though they are associated with increased risk of heat-related hospitalization. And I want to focus on why these things are. So some people perceive that the heat is not a threat to them, and so they don't take protective actions. And then on the other hand, we have barriers to action, right? And these are both based on the health belief model. And the barriers, as we saw, I'll get into both of them, but yeah, the barriers we could see is probably associated with that poverty. So no amount of warnings in the world are going to give you the money you need to pay your bills. So here are some things, I see these on Reddit all the time, people posting about warning, don't go hiking in the heat, don't do it. It's only 6% of cases occurred as a result of physical activity, but I think this demonstrates the threat perception, right? So people constantly saying, don't go hiking in the heat, and then people constantly posting, hey, I'm coming from out of town, I'm thinking about hiking in the heat in the summer. And then here you can see on the right-hand side, somebody kind of perceived that the heat might be a threat, listen to what people said, and then change their behavior. But this is unfortunately not always what occurs. So there's been several high-profile deaths, both in Arizona and in the West specifically. But a mother died, a 44-year-old mother died hiking with her family. She was not able to get treatment in time in Sedona. And then we've got had a couple hikers die in the Grand Canyon in the last month or so. And this is all because the standard of care is cold water immersion, and it's just like not feasible to have electricity in remote places where they're making ice and having treatments available for people who need it when they need it. So this is a problem that definitely still needs to be addressed. Now I want to talk about those disparities. So that last part about the barriers. These are the social determinants of health. They determine basically health outcomes. I don't have a lot of time to talk about them here, but I think they're important to mention. Heat-related mortality is associated with low socioeconomic status. So we saw earlier that 45% of people were unhoused. And then we saw that 33% of indoor deaths occurred as a result of basically people not having the money to run or fix their air conditioning. Something else I wanted to mention is these racial and ethnic disparities. Marginalized groups nationwide are at greater risk than non-white Hispanic individuals of experiencing heat-related mortality. And that's a whole, racial and ethnic disparities are a whole other talk, but I think it's important to acknowledge that they exist. All right, the last part here, heat and child safety. Why am I talking about this? I pulled some stats here from Arizona. You can see here on the top in Arizona, the heat-related emergency department visits by children, relatively low compared to other age groups. And deaths by age group in Maricopa County, very low relative to other age groups. But why am I bringing this up? Well, adults play an outsized role in the health and safety of the children. And so if the adults surrounding that child have poor threat perception or aren't overcoming the barriers that they need to care for that child, then that child doesn't have the autonomy to make the decisions to reduce their own risk. So I pulled some screenshots from Reddit here. You can see, I think it was maybe a week and a half ago at this point, that a 2-year-old girl was left in the car during the heat wave. The car was on with the air conditioning on. The father went inside for about, I think it was 3 hours playing video games. The mother came home. The car had turned off and the child had unfortunately passed away in the car. And so now that father is being charged with murder. We had the case of a 10-year-old boy who came in from out of town with his family, went hiking on South Mountain during basically the hottest part of the day. I don't know the specifics of what happened during that day, but unfortunately they were not able to save this child's life. And then the last one, this one occurred on the 4th of July at Lake Havasu. The family went boating, took the 4-month-old child with them, stayed out all day, from my understanding, in 120-degree weather. Call came in around 5 p.m. and unfortunately this child did not, also passed away, unfortunately. All right, so some challenges to this type of research. Well, I talked earlier about how these heat-related deaths often occur with, other health conditions. And so how do you know which one is heat-related versus some other type of death? And I pulled this one from Reddit. This was a debate on the Phoenix subreddit about an email that came home to a school about some children who were experiencing stomach cramping, dizziness, a couple of other, and they weren't sure if they came from hazardous materials or drugs or something else, but this was in September during school after recess. And so the consensus was that it was heat-related illness, but in these cases, they're likely not to be reported, right? These people are probably not going to go to the doctor. They may or may not go to a school nurse. If they do go to a nurse, who knows if that's being reported. And so this is representative of children, but this is also representative of the problem at large, is like, how do you identify all of the cases? How do you define what a case is? All right, so finally, here are some projects that my team and I are working on. We're finishing up this first one on predicting risk of heat-related hospitalization using machine learning algorithms. So we hope to start working on some dissemination of that in the fall. We were just awarded a grant to work on current and predicted risks of exertional heat illness in youth athletes. So look for that one starting in fall. And we have a grant going in next week looking at the National Weather Service heat index versus heat risk for children, since Arizona recommends using heat index for administrators to make decisions about outdoor play. Got my link to references, and thank you very much. I'm always open to collabs. Feel free to reach out.
Alicia, thank you. That was fantastic. Some incredible statistics, some incredibly sad stories. Really quite a challenge we have at hand. There are questions that have already popped up in our Q&A. For everyone attending today, please remember, if you have a question, post it in the Q&A, not the chat. And at the end of both of our talks, we'll have time to open up the floor for questions. Also, just one other quick reminder before Patricia comes on. If you haven't already done so, make sure you get credit today for attending by using the self-check-in link posted in the chat. And now, without further ado, we have Dr. Patricia Solis with a presentation titled "My Hot Take on Extreme Heat Preparedness and Resilient Solutions." Patricia, it's all you.
Great. How's that look?
We're still seeing
Good.
your
We
other
just
slides
switch.
that you
Okay,
messed up.
we'll swap. There we go. There we go.
Looks great. Thanks.
Thank you. Yes, Ali, thanks so much. And Alicia, that was really fantastic. And I know you're going to see a lot of the resonance across our work because we care so passionately about the effects of extreme heat on the health of our communities. And I wanted to gear a little bit of my hot take to be about some of the solutions that we are putting in place, and also just a little bit about my experience just this past year in the wake of what was the hottest summer on record for Arizona, and how our state and our communities are responding to that, and share a little bit about that with you. So I want to underscore you saw the maps that Alicia shared, but this is over time, month by month, the very dark red line at the top with that little dot, that was July 31st of 2023, very much above what has been the norm for our seasons and daily surface air temperature. You can see that, that peak happens in the month of July. So here's another view of the same kind of data for the world, where 2023 July really outstripped what we've experienced before. I think it's very important to level set with this kind of data and understand that even though we know that Arizona is desert and it's a hot place, there is this broader context. There's a scientific consensus about what it looks like. And even here in the state of Arizona, this was a visualization created by my team where we took from the Office of the Arizona State Climatologist all of the monthly temperatures since the year 1900, organized them by month. This is actually the monthly low temperature. So you can see those nighttime temperatures even have increased over the years, where each column is at the left 1900 and at the right 2020. And you can really see that this change has been a long-term occurring change, and it's not something that is going to go away anytime soon. As I mentioned, July 2023, really a watershed moment for us globally as well as here in Arizona. But unlike other threats, Alicia said heat kills more people than all these other weather hazards combined, but it looks different as an extreme weather situation. I often speak to media and they want me to come and show them what does this disaster look like. And frankly, it looks like a sunny day. So how and when and where do we find the way to respond? If you can't see a problem, how can you address it? So that's what makes this issue so insidious and a big challenge for our community. You can see the impact on the outcomes of morbidity in Maricopa County. This is from the County Public Health Department from last year, increase of 52% over the year before. We would love to have this kind of information in real time. And the dashboards and everything that the county is putting together is really helpful. But there are certain parts of the year, as I mentioned, and in the summer months, you can see where these darker occurrences, the higher numbers of deaths are happening concentrated in the middle of the summer in July. And during these 2 weeks of July 10th through 25th of last year, about half of those deaths did occur. However, a good percentage, even 30%, up to 30% of heat-associated deaths occurred outside of the excessive heat warning. So there's an awful lot to pay attention to, even though we can have these periods of really intense attention. So what are we doing that's working, and what are we doing more of as a result of this? For many years, you've seen the cooling centers and the cooling center network grow and be supported by our community, the faith network and the community action agencies, the local governments. There's now starting to be mobile buses put in place to increase that kind of capacity and the mobility of that to address exactly where we're seeing the need. Of course, since about half of the heat-associated deaths that occur outdoors are among people who are experiencing homelessness, the outreach proactively to people experiencing homelessness is a really key part of this response, as are in recent years from our realization that people who live in mobile manufactured housing are completely disproportionately affected because they are more exposed through the type of housing that they have. There has been a marked increase in outreach for people who are residents of this type of housing, at least in Maricopa County in Arizona. Lots of help with air conditioning and weatherization and utility assistance. It's just obviously not keeping pace with the increase in results that we are seeing as a outcome of climate change. Green infrastructure and shade is also another very important sort of mitigation and that can have a real impact on the response, but it's more of a long-term solution. And then it's not a solution that comes with a few trade-offs, such as having to pay for the water. And we also saw a lot of trees die, even native trees die in the extreme heat last summer. So we need to think about how we use that green infrastructure and where. So all of those things already going on, but needing more attention. And obviously when those solutions outpaced our ability to keep up last summer, the governor issued a declaration, an executive order that was in response to this, to have the various agencies of the state come up with an extreme heat planning and preparedness plan for this summer, in addition to a number of sort of emergency actions that took place immediately. So this is not a usual action by a governor. Extreme heat is normally not seen as something that, like a disaster that we declare disasters over, but this actually allowed the state government to open up some of the resources that they had. So this was in August when the order was issued, and in September we were approached by the Office of Resiliency because the executive order tasked the Office of Resiliency to coordinate this. We work very closely with the Governor's Office of Resiliency since it was established, and they asked us at the Knowledge Exchange for Resilience to help them understand within the government agencies that were named in the executive order, what could we recommend from the vast amount of experience through the academic community, the stakeholder community, and in a very short term, the public as well. So we did conduct a public request for information. We scrambled to work through our networks to gather all of the best information, and we compiled a report that we issued in January for them to be able to process that for their March 1st plan. We did a number of convenings with the 10 state agencies that were named in that executive order. It was the very first, the country's very first whole of government approach by a state that involved more than one agency, more than just the state health department and the emergency management agency. So we see this also as a work in progress. There's obviously a lot of recommendations that could not be taken up by the plan. So there are many things left to do still. But again, this was really the first time that it's looking at a statewide systems approach to help coordination across the multiple agencies, everything from transportation to administration and health and emergency response and housing and all of those things. So we were really pleased that some of these recommendations could be taken up. Chief among them was for the state to appoint a chief heat officer, who is also the first in the nation. They not only accepted that recommendation, they immediately appointed Dr. Eugene Levar to coordinate, and they are very busy this summer in action with the existing networks and also improving the communication and the resource flow across all of these state agencies. So we're beginning to see already the impacts of that. We focused some of there are 41 recommendations. We focused some of them around who are the most vulnerable. You heard Alicia talk a little bit about that. And There's a lot to say about these. Protect children, obviously, was one of the recommendations. Working with tribal governments, it's really important. And also trying to spotlight some of the solutions that are ready to go or should be put in place and are invested in, such as low-cost heat detection warning devices. We're working with some engineering students here at ASU on our team who have developed a prototype of a warning device that could be used in mobile homes, especially to try to alert loved ones if it's getting too hot in there. We need to really protect our uniquely vulnerable populations to extreme heat and really think about universal power provision for the basic fundamental electricity needs just to even run air conditioning and keep medicine and refrigerators working throughout the summer. We also looked at some of the recommendations that have to do with where we live, right? Supporting housing in particular, as you have heard, people without homes and people who live in housing or housing insecure are extremely at risk. And so if you want to move the needle on the heat problem, moving the needle on the housing issue is a big way to do that. And so looking at some of the heat preparedness plans of different type of housing and promoting housing, incentivizing heat smart housing is really, really important, and giving shelter for people who are missing the housing. Again, we often look at green infrastructure as one of these solutions. We promote that as well. Nature-based solutions are really important, but we do want to remember that, you know, look what happened to the saguaro last year. Sometimes the heat is a lot for our green infrastructure. We need to come up with ways to mitigate that as well, and more outreach where we live. Some of our recommendations have to do with the places that we work, where we study, where we play. We're giving a shout out to the Heat Ready brand of action that is ubiquitous across the state. There's a Heat Ready Schools effort as well. It's really important to think about heat safety in the workplace and workplace protections. I know there's some new proposed legislation right now that Gallego has put in place to consider this. But beyond just workplace safety, we wanted also the state to think about the workforce capacity. Can we grow our ability as a community, and not just as individuals, but as a community, our workforce strategically, to improve the healthcare workforce, improve the HVAC workforce, weatherization workforce. There's a big bottleneck in getting those weatherization dollars out there in terms of, you know, construction companies that are specialized in retrofit. So we need to elevate attention to those kinds of issues and the specific ways that we are addressing heat, not just in the workforce as workers, but also as a society, how we organize ourselves and what we work. We also have a lot of recommendation about data and knowledge. There's some of these things starting to be put in place in terms of the campaigns, especially in different languages, adding heat safe efforts to the emergency information network and sort of combining these types of systems that have been typically siloed, but also tracking things in real time. How do we know what's going on now so that we can respond better and quicker? And those weeks that are really of high concentration that we have, we are on the ready, just like we would be for any other kinds of disaster. The other thing that we are doing as a university is really participating in the way that we calculate and think about risk. And actually just this week, the Census Bureau released a second version of the Community Resilience Estimates for Heat, the CRE for Heat. I'll show you a link here in a moment. That gives us better ideas about the elevated risk in different parts of our communities directly from the Census Bureau, and ASU helped the Census Bureau create that new experimental data product. We have to keep our knowledge updated on the climate assessments as well. This is a moving target, and we need to, as a state, pay attention to those things. And lastly, I think that the recommendations that dealt with a lot of the state functions for incentivizing private sector action, incentivizing economic development that is climate resilient, and analyzing the costs and benefits of doing so is really critical. The investments that we've made in our cities, such as this extreme heat offices in Phoenix and Tucson, is a really good example of how we can be proactive about mitigating the issues and investing in our infrastructure where we can thrive as a city, as a community, as a state in the future. So if you want to see this full report, you can look at this QR code. We have published it at the ASU libraries. And again, super happy that the governor's office took up some of these recommendations as a starting point for their extreme heat preparedness plan that was released March 1st. You can also get that at this QR code and from our website. They also consider this as a work in progress, and we continue to work with the office of the governor's Office of Resiliency and the fantastic people there, Director Marin Mahoney, on continuous improvement. Because, you know, this, as I said, it's a moving target. Looking ahead, you know, 30 years from now, about 2/3 of the US population will be at risk. And that includes our neck of the woods, even higher risk. Globally, almost 500,000 people perish from heat-associated deaths. And 850 million currently live in places where they are at risk. By 2070, the estimates are that will reach 2 billion people on the planet that are going to be in the same boat as we are. I mentioned to you the solution, some of the data solutions. We really want to pay attention and get ahead of the game and use our knowledge and predict where we should be investing these solutions. So I want you to check out the release. A shout out to my friends at the Census Bureau. They just released a new version this week on an experimental data product, and we're really excited about that, because we really need to understand this from a community level. It seems to me that because the effects are felt at an individual level, unlike other kinds of disasters like flooding and hurricanes that we can see affects the whole community all at once, it seems to me that we push some of the responsibility for these solutions at the individual level as well. Drink more water, that's great advice, but we need to also think about how we master community resilience and go beyond the kind of awareness and warning systems. And so we really change our infrastructure so that we're resilient as a community as a whole in terms of equity and justice, because not everybody feels these things in the same way. Solutions that I think epitomize that principle include one that I was involved with, our research had informed, was the passage of the House Bill 2146 this last spring, which provide protections for people who do live in mobile and manufactured homes, that their landlords cannot prohibit them from installing reasonably necessary commercial cooling methods. And you wonder why we need law to be able to validate this and ensure this protection. But sure enough, there are some barriers to people helping themselves as well. This is one of the things I mean when I say we need to improve our infrastructure for doing so. I'm heartened by the fact that I want to share this with you, that there does seem to be community-wide consensus on these solutions as well. This bill, I testified in the Commerce Committee and it passed unanimously there, but then to our delight, it passed unanimously in the House, unanimously in the Senate, and was signed by the governor with an emergency order. So it's in effect this summer. We can't agree on some things. There's a lot more left to be done. Chief among them, there's a lot of attention right now to adding extreme heat to the declarable list of disasters in the FEMA space. It's called the Stafford Act, which governs FEMA's treatment of which disasters can be declared disasters. And there's a great deal of energy and effort trying to draw attention to the need for enabling more resources for the entire country to take heat as seriously as it needs to be, so that we can put those policies in place, we can put those resources in place and the solutions to meet the vulnerability that we've been talking about. Thank you very much.
Wow, fantastic. Both of you, Patricia, thank you for sharing all the work that you and your team and many partners have done to support solutions and strategies to overcome these many heat challenges. We have some questions in the Q&A, and I'm excited to get to them. A reminder for everyone in the audience, please post questions if you have them in the Q&A directly, not in the chat. This first question, folks asked about some statistics. Alicia, it was in your presentation, but I think the question is relevant for both of you. And this question is about the characterization of homeless in the statistics that the Arizona Department of Health Services uses, I think, in their dashboard. And so folks want to know if individuals living in vehicles, not RVs and trailers, but vehicles, are considered homeless in the statistics in the dashboard, the statistics that were shared earlier.
I don't know the answer to that. I have to look into it. Patricia, do you know off the top of your head?
I believe the answer is yes, but I would want to confirm that. Typically in those statistics, if you do not have an address, that's what's considered a person's experience in homelessness. And even if you are maybe staying with other people, sometimes you get put in that category as well. But for the purposes of the heat related statistics, my understanding is that yes, people who are living in vehicles are not considered among indoor heat associated deaths. And you're right, RVs and trailers would be considered the home if that's where they call themselves home.
All right, thank you. Thank you. So we have another group of questions that ask about the more immediate and long-term impacts. And so I'll ask both of you, what point of actions have you seen to have the greatest immediate impact and long-term impact potentially on morbidity and mortality?
You want to take that, Alicia?
So my work is specific to youth athletes, and I would say the implementation of activity modification guidelines and acclimatization guidelines have a huge impact on reducing morbidity and mortality on high school athletes, for example. So policies, when implemented, reduce risk by 50%. And that it's heat illnesses are among the leading causes of death and disability in that group. So you know, and those are related to the adults around the child again. So not actions that the child is specifically taking, but actions that the adults around the children have to take.
That's fantastic. And I would just add from my perspective that I really like this question because you take different actions if you're talking about the immediate, like near-term response. Those kinds of things really do have to do with probably swelling the response in those hotter months, swelling the proactive and outreach to the vulnerable populations that we know are going to be experiencing these things, particularly, you know, whether it's a vulnerability such as age, like the elderly, or exposure vulnerability, such as people who are without homes or experiencing housing insecurity. Those are the immediate kinds of things that I know that we can do. I really do believe, and I've heard many physicians say this, that 100% of heat-associated deaths are preventable. And so those immediate responses are really important. But as a society, if we're looking at that systems view and the long-term view, and we look at those statistics, really, it's good for all of us to address those systems improvements to housing and energy. If we can ensure that housing is affordable housing and housing that is cool, is ubiquitous, smart housing, that is better for all of us. We need to be prepared, however, for not just thinking about heat affects the most vulnerable, who we've been talking about, but it could affect all of us if we were, for example, in a major blackout for an extended period of time in a heat wave. There's a lot to be done to prepare for that. There are people that study that and are working on that issue, but I don't think as a community that we are prepared for some eventuality like that, and it could really be significant to all of us. So having those big systems in place that are going to protect all of us are really good for the long term and good for everyone.
Thank you. And we do have several more questions, follow-up questions, really that speak to a systems approach and the ability to mitigate some of these challenges and prevent some of these disasters before they strike. But first, Johnny Sullivan, I believe you have your hand raised. If you'd like to ask a question, we'll turn you off mute and you can ask the presenters yourself.
Oh, hi. Sorry. Thanks for this chance. I also put it in the chat, but I was just curious. I might have missed this. Are there any protections for people like at risk of losing electricity during summer or hot months due to like financial reasons? Thank you.
Yes, Johnny, there is a certain period of time where there is a moratorium on shutoffs, where the utility companies will not shut you off if you cannot pay. And that came about because of a case that was a very sad situation of someone who had paid but didn't pay 100% and ended up getting shut off. And so since that time, the utilities have a summertime moratorium that is every year. Now, that's not a forgiveness. They do have to end up paying that. And so what we see and what you saw, Alicia did share some of those statistics with you. If you're parsing out some of the lack of air conditioning, some people, in the indoor heat associated deaths in particular is the what I remember the statistics, about a third of people who die indoors do have electricity, do have working air conditioning, but they did not turn it on, presumably because they decided that they couldn't afford it.
Thank you. So,
yes.
oh, Patricia, do you have something that cut you off?
No, that's okay.
All right, so we have a question in the Q&A about using a model, a disaster response sort of model, and applying that to heat challenges. For both of our presenters, what do you think that might look like if we mobilized our emergency medical services and hospital resources and the identification of high-risk people during times of high heat, if we know that those times happen during a targeted month of the year every year? What could that look like?
I have questions about that, what that would look like, because the data says that people aren't good at perceiving their own risk of threat, their own threat of heat. And so these heat warning systems, we have them and people seem to not be heeding them anyway. So I would imagine you would mobilize these services. There might be a proportion of people who respond to those services, but I would say that probably by and large, people just aren't good at assessing their own risk. And so probably not that great mitigation strategy.
Yeah, you've hit on Alicia, you've hit on a real sticky point. And that's why I think we are not treating heat as the disaster like we treat hurricanes and floods, because you can kind of see that coming. And again, even then people decide to board up and stay and, fight the hurricane, and I'm going to stay in place and not evacuate. So you still see the human behavior like that. I think we're uniquely optimistic as human beings. But having said that, I do think we need to take a cue from some of the other kinds of disasters. Every one of them are slightly different. Knowing when and where it's going to hit and trying to make that more visible, and make it more visible who is most at risk. If we can keep refining that and refining that, I think we can be a little bit more proactive, and not everybody's going to listen. But I do think that some of these ideas that came about around, workforce and workforce surges, especially in the summertime, we really could use more hands on deck during those months of July. And that's sometimes what FEMA does. They sort of have a surge or an influx of support, whether that's from other places or, getting that human capacity to respond. I know that I heard from some of our emergency room physicians community that there were some emergency rooms that were overwhelmed in those 2 weeks in July. They ran out of ice, some other kinds of things that we could treat this as a disaster. Having tents, some shelter, makeshift shelter for places, and all of those kinds of things. I think they're being contemplated, but we have a ways to go before we can really hit it in the same way.
And to build off that, Patricia, you talked about developing kind of tailored solutions. Have you seen a push for any community-led solutions for heat relief?
Well, the city of Phoenix is doing amazing work with their homelessness outreach this year. I don't know if you all are keeping tabs on that, but just a lot of activity and proactive activity on that. The Faith Network, the Arizona Faith Network in particular, has improved the way that they handle, tens of thousands of people every summer, and connecting with other kinds of services. And now with the state being involved, we hope that that's going to make a difference this summer.
So we have several questions about recommendations and resources. And so I'll try to lump them together first. What resources exist for the both of you to help schools and children improve or prepare their outdoor play areas? Is this something that schools are being more equipped to handle? Are there resources to support them?
I actually became interested in this because my kids, I get emails from my kids' school principal about the heat index, and the heat index is high. And I'm like, so the principal is making the decisions about when the kids are going outside? Okay. So we looked into it, and the Arizona Public Health Department does have recommendations based on the heat index about when kids should and should not be playing outside. What are the thresholds for playing outside? Who is making sure that those are being implemented properly? What does the success of that implementation look like? I'm not sure. But that is a resource that is available. I'm not sure if there's additional trainings available to school administrators, but that's something that's available. There are also position statements by the American College of Sports Medicine about physical activity in the heat. National Athletic Trainers Association has position statements about physical activity in the heat, heat illness prevention. So if anybody's interested in those things, you can take a look at those position statements.
I would just add that there are some resources from the Heat Ready Schools program, and that is really centering on, there is a resource page for, that includes everything from, lessons plans and information for parents. So take a look at that if there's something in particular you're looking for. I put it in the chat. I don't know if that was the right place.
Thank you. I think everyone can access that.
Yeah, that's great.
Do you two know about any requirements or codes for new building construction to use materials for heat resistance?
That's a very good question. I only know, I don't follow that as much as I probably should, but I do know about that for mobile and manufactured homes. And there are some efficiency standards. They need to be updated. But the newer models of mobile manufactured homes do include more energy efficiency standards. I also see personally a difference between having something that's energy efficient and having something that's heat ready. And if I can explain, there's energy efficient means that you're using less energy, or that the energy that you use does not get dissipated. And those things we have pretty good standards for. But heat smart kinds of things, which would include like your heat smart thermostat, where you're really optimizing what your resources are. That doesn't necessarily mean that you're paying less. It means that you're more comfortable, thermally comfortable. So there's some technologies that fall on that side, which I think that's a real space for innovation and change in the future.
And this is related to a question that folks have about state programs to support grass replacement with artificial turf, specifically because although it saves water, there is a notion that artificial turf also increases surface temperature. So is this a strategy that is heat ready, heat smart? What's the context of this strategy in the big heat picture?
Yeah, that's a tough one. Every one of these solutions has its trade-offs, and we talk about a lot about that in the literature on resilience, that there's trade-offs sometimes that you have to make, and you know, it's ironic sometimes, right? Like even provision of electricity, we know that that will save lives and impact people's health in the very near term in your homes. It's necessary to survive. However, kind of ironic that that requires electricity, and the way that we get our electricity, sometimes there's emissions. Oftentimes there's emissions associated with that electricity, which is exacerbating the overall problem. So this kind of a complex system is something that we definitely think a lot about. I think that in terms of, if you are looking to do something like that, it will require a lot of contextualized analysis. Like, where are you talking about? What other options do you have? Really do a really good cost benefit analysis and make those choices on the basis of what those trade-offs look like for you in that context.
That's important. And I imagine also getting perspectives of various experts from various fields working together is so important and so challenging. One of our panelists has asked if horticulturists and arborists are being brought in as plant experts to help with some of these greening projects to better inform the plants that can survive in heat islands.
Yes, I know that there's urban foresters. That's another workforce development opportunity, right? Urban forestry. The city of Phoenix, I know, does a lot of this work on their tree programming, and City Mesa also has one that's a million trees that they're trying to plant, and they do have experts that in urban forestry that will help you pick, what are the right species that can provide shade at the same time they take less water. They're going to grow and survive there. I know they're not pine trees. Those have suffered.
And what about experts and agencies in the transit field? Do we know if Valley Metro or other transit agencies are partnering to come up with heat-related solutions?
I know about a few examples. Again, the city of Phoenix being out front in some of this, they look a lot at the bus stops and shade at bus stops. That's been a priority for the city. So that will involve transportation. Also transportation workers, people who are out there, they've changed the times of day of the workforce on when they have for worker safety. Those are a couple of the examples. But I do want to say that the Department of Transportation for the state was mentioned in that executive order. And so they were part of these conversations. And while at the beginning, they might not have had a lot of ideas on what role they have to play in extreme heat preparedness, those ideas have been flowing. And I think that there's a significant role for transportation, including something like, what do you do for, like I mentioned, the black swan, extreme heat, a heat wave and massive power outage? Then do you have evacuations? That looks like a transportation issue as well.
So for both Alicia and Patricia, we know that there is no one solution to these challenges, but if you had to pick your top 1 or 2 approaches to implement at this point in time, what would they be?
I don't have expertise in people experiencing homelessness or indoor air conditioning. I will say for physically active populations, I would personally consider policies that maybe shut down the trails, policies in the schools about there. I'm sure this. I don't think there's a state level policy. I think each individual school probably has a policy about how they handle heat, but there should probably be some policy at the state level indicating what people, you know, when children should be outdoors and when they shouldn't.
Yeah, that's very smart. And pretty easy to implement, I think. So that's a really good choice, Alicia. I like this question a lot, and I saw that David asked something along this effect. Fortunately, I'm going to hedge on this question because I think that everyone should pick one and do it. I feel like there's so many solutions, but it's not like there's only one entity that should be implementing all of those. We all should take our part. So look around, what could you be responsible for? Maybe it's only check in on your neighbors. Or maybe it's something like address homelessness. I feel like, you know, if you wanted to move the needle on heat-associated deaths, that's a fantastic place to start because it's very disproportionate. People are 300 times more likely to experience death if you do not have housing. So that's a big needle to move, but yet how can each one of us take some kind of action and move a lot of those little needles forward? I think it's one of those complex solutions that we all have a role to play.
Yeah, that's wonderful. Thank you both so much. These were such wonderful presentations. That's all the time we have today, but we encourage you all to follow the College of Health Solutions on social media. You can learn more about other opportunities like this one, including our next Health Talk series that will be on September 19th with a discussion on autism in all ages, updates and resources. Details and registration will be available at asuhealthtalks.com. Thank